My name is Sarah Montgomery, and today I'm going to show you how to insert an NG tube. So the first thing I would do is verify the order. I would gather my equipment. I would knock on the door, identify myself, identify the patient using 2 patient identifiers and check their allergies, scanning their wristband if they have one. I would explain the procedure, perform hand hygiene, and provide privacy. I would make sure to use my general principles and safety practices, and then I would raise the head of the bed up to a high Fowler's position, make sure that I have good access to the patient's nose, and I would apply a drape. Usually the bed would be higher than this, but that is not available at the moment. So first thing I'm going to do is measure the tubing. I'm going to show you how I would do it on myself because I do not have a full face mannequin. I would get the tip, put it to the tip of the nose, to the earlobe, and then from the earlobe, the xiphoid process. And then I would get a marker, an indelible marker, and mark it. So mark, put that on a clean surface, and then I'm going to put on my gloves, hand hygiene, and then gloves. And then I'm going to assess the nostrils. I'm going to occlude one, have them breathe, occlude the other, have them breathe. See which one was good. If they're both good, then that's okay. And then ask them if they've had any facial or neck trauma, and then ask them which preference they would have. Now that that is done, I'm going to explain the discomfort that they were about to experience. As I said, I already explained the procedure. And then I'm going to clean the nose with an alcohol prep pad. And I'm warning you now, the tape does not like to stick to these, so if it comes off, it's because it's not a normal face. Okay, so I have my lubricant. I'm going to get the tip 2 to 4 inches lubricated. I'm going to have them tilt their head back. Big breath in. And then once it got to the back of the throat, I would use a tongue blade to open their mouth, make sure it's not kinked up in any way. And then I would keep advancing after I had them tilt their head down and gave them water. So every time that they would take a sip, I would keep inserting until it got to the mark that I had made earlier. So I'm gonna hold that. And as I said earlier, the tape does not like to stick to these mannequins' noses. I have secured that. You can see that I've secured it to the nose. Now, I assessed for coughing while I was doing this. The patient didn't cough, so I didn't have to withdraw. If they started coughing, I would take the tube out and restart. Now I'm going to assess the respiratory status. Like I said, the patient's not coughing. Their O2 sat is at 98, which is reasonable for this patient. And they're not cyanotic. So I am going to test the patient's stomach contents pH value. So I'm going to insert this and then withdraw. Put this in a kidney basin. This represents my kidney basin. Put that back in. Now I have a pH strip right here. I am going to put this on my pH strip, and I would have got a new one since it dropped. And it is between 4 to 6, which is representative of stomach contents. It was a good consistency. It was a normal color for this patient's stomach content. Then once that was done and it was in a proper range, I would ask the doctor for an x-ray. And then once that was done, I can actually place the final tape. I'm going to remove this if I can. making sure to secure the catheter, or not the catheter, the tubing. It's not coming out. And that's going down the tube. Once that was fully removed, I put this on the nose, and then wrap it. For the purpose of this demonstration, I'm going to say that I would put this on the top of the head of the bed so that it would be above stomach level. Again, making sure to secure this, making sure that it's not sliding out at all. I'm going to make sure not to make this too tight. The patient can turn their head. It's a good length for them. I would put another piece of tape on top of this just to make sure that it's fully secured. Again, this wouldn't be here in real life. I would remove that. So now that that is secured, I am going to measure the length from the exposed tubing to the end. And then I would mark on the tubing as well. I put that in my charting, and then once that was done, this is secured. The nose is not occluded except for the nostril that has the tubing in it. The other nostril is okay. I would secure this to the patient's gown, and I would put this, make sure it's above stomach level, and hook it up to suction if ordered. So then I would remove my gloves, perform hand hygiene, report, get rid of all my equipment, and come back and evaluate.